viewers, Assalamu alaikum. How are you all? Hope you all are going well. We are here with 1026th episode of Medi Life, and this is a continuous episode. Mano Aesthetics and Laser Center is with us, and thank you, Mano Aesthetics and Laser Center, for being with us. And today we are going to discuss about anti-aging Botox treatment. And for discussing about this important topic, Dr. QM Maruf Mahbub Asif is with us, and he is a consultant, Impulse Hospital, and he is also aesthetic consultant, Mano Aesthetics and Laser Center. Dr. Asif, welcome to our show, our today's episode, and hope you're doing well. Assalamu alaikum.
Walaikum Assalam. Thank you very much, Dr. Umi, and dear audience. Thank you very much for being with us. So let's start the topic which will be discussed today. Thank you very much.
Dear viewers, our episodes are for you, and please be with us and make your questions. Put your questions in our comment box that is open for you. We are live on Facebook and YouTube. And be with us. We are discussing today about repeating anti-aging Botox treatment. And Dr. Asif, I want to know from you that what is Botox? We all know about the aging process. We all understand from the word anti-aging, what does it mean? But what is actually Botox? This is a new word.
Thank you very much, Dr. Urmi. Actually, Botox is a commercial name, but the original name is the botulinum toxin. We collect it from the organism called Clostridium botulinum, which is a bacteria. You know, any kinds of medication, some kinds of antibiotics, we collect it from the organisms and selected it out, and we collect the appropriate protein from the toxins, then we can apply it in our medical term. So that's why botulinum toxin is an appropriate treatment for an anti-aging process, which is collected from the Clostridium botulinum toxin. And nowadays it is called purified protein, because toxin name is absolute right now. So we are calling it purified protein, which we collect from the toxic properties, and these properties doesn't have any kinds of side effects like hypersensitivity or any infective causes. That's why Botox is used in our medical term for anti-aging process.
Okay,
Thank
so
you.
the alternative name is good as well, because it's actually fearful, the word toxin, and
Yeah.
using this toxin to treat a problem, to treat a aging process. So where to apply this toxin, botulinum toxin or Botox?
Well, actually, botulinum toxin, that toxin products has many kinds of effects, but in which part of this toxin can relax the muscles. That properties are isolated from the toxin. That's why it's called purified protein. And this purified protein is to use in the muscles which are very actively working in our bodies and causes some wrinkles in our bodies and causes some effects on anti-aging process. So we use in that areas which are the signs of our aging process, and we can use this Botox in that area. Actually, we have some wrinkles in our bodies, like in the dynamic wrinkles and some static wrinkles. In the area of the dynamic wrinkles, we use this Botox treatment. And I can tell you that what is the dynamic wrinkles actually, that the wrinkles which comes after our movement of our face. Dynamo means the movement. So when the wrinkles comes with the movement like this, I have some wrinkles like this. If you have some wrinkles here, these are the dynamic wrinkles. But when the face is in the normal position without any movement, like this way, so if there is some wrinkles appears in our face, this is called static wrinkles. Especially Botox is used for only the dynamic wrinkles, not for the static wrinkles, because dynamic wrinkles has some more effects in the face, and with the age it increases day by day and with the years and years. So we can use this botulinum toxin, that means Botox, in that wrinkles area and the muscles area actually, to reduce or invisible the area of the wrinkle. That's why we can use it. Thank you.
Okay, so this is the place actually where you can apply. We can apply the Botox or botulinum toxin. So now I want to know that how it's applied actually. If you can tell us in elaborately, can you please explain us?
Well, thank you very much. Actually, we directly inject this product into the area which we need to treat it. So the commercially producted is given by in a vial, but we diluted it with some salines or distilled waters, then in an appropriate way, which only a aesthetics consultant or aesthetic physician knows what is the appropriate dose to dilute the toxins, because without the toxin the concentration may be very high and can cause many kinds of side effects. Okay, so we dilute it and we making the appropriate concentration, then we judge that which concentration we should be applied to which persons in which concentration which area, and according to the gender of course, because male and females have different kinds of muscular activity. Some fat and some lean thin persons have different kinds of muscular activity. The active persons like athlete or gym persons who usually go in the gym, and those persons which just pass their sedentary life, so their muscular activities are different. So we have to calculate, we have to judge, we have to consider everything, and then we have to apply the toxin in an injectable way. This toxin cannot be eat or swallow. It will not work because your our gastric acid will just digest it and burn it. We cannot give it in the saline like blood channel, so we have to apply it in the direct position. And of course we have to be very careful that in which area we are giving, in which concentration and in which depth in the skin we have to apply that one. Thank you.
Okay, thank you very much for discussing it elaborately. Now, I want to know who are the actual indication, who are the people, accurate people to get this treatment, this modality of treatment.
Well, thank you very much for the questions. Actually, those persons have the actual wrinkles, dynamic wrinkles is very deep in their face, and also the persons who want to do that to reduce the wrinkles and to invisible the wrinkles he or she has in her or his for face, so they can do the Botox treatment. Actually, Botox treatment is not appropriate for everyone before the aging process starts like 25, but some cases we have started from the 25 years to above, because with the age our collagen fiber, our hyaluronic acids and our elastic fibers of our skins and also our muscles, it decreases because the supports for the muscles is the connective tissue. So the supporting elements from our for our muscles and bones are reduced. That's why with the aging process our muscles become loose and also our face become shaggy and goes downward due to the gravity. So when we are younger, our face is prominent in this area and tighten in this area. But with the age, when the support goes out, so our face become shaggy in the lower area and face become bulk. That's why we have to use different types of Botox from to different area in different dose along with our face, because our forehead has frontalis muscles and also our scalp bone. When the attachment between these two become loosened, then there will be wrinkles appearing in our forehead. That's why we have to apply in those person, but mostly the patient's desire, because many patients like the deep wrinkles, some are not, they want that it should be reduced, and like actors or some video makers, those making the video, so they want that I don't need any wrinkles, so please remove it, and we do that for them. Thank you very much.
Okay, so I think that nobody actually likes a wrinkle present on their faces actually, and this is what the aging process actually means. I actually wanted to ask you about the aging process. What does aging process mean? So you have already told that. So now, can I know the contraindications of using Botox? Who are the people whom you cannot apply the Botox?
Well, Botox should not be applied those persons who are pregnant. So it's a physiological condition, and Botox can activate many kinds of muscular relaxation. So it should not be used in the pregnant women. Along with those are hugely alcoholic. Alcohol can destroy the botulinum toxins effect in the muscles. Along with those are having chronic disorder, hypersensitivity to any toxin or any medication. So we have to think about that thing. If any person have any active infection over the face where we have to inject the Botox, then the infection can goes deep in the skins and as well as in the deeper muscles and also into the vascular area. We should not use it those person who are have tendency to form a keloid. Keloid is an elevated scar mark where trauma appears. So there may be formation of keloid if that botulinum toxin is given at that area. Also, if have patients have some tendency to having some viral infection like herpes simplex, okay, so we don't have to use that. And as the botulinum toxin should be used by injection with the subcutaneous injection or dermal injection actually, or in the muscle area. So those persons who has bleeding disorder or platelet count is less, we should not use that one. And if the patient has some any joint problem, any rheumatic problem, or any vasculitis, then we should not apply on those area and those persons. And we have to judge that whether the person is diabetic or not. If diabetic, so diabetics should be in controlled area, because if the diabetes is much higher, then every puncture can cause infection in the particular area. That's why we should avoid in those persons who have these kinds of problem with them. Thank
Okay,
you.
so these are the contraindications. There are several contraindications actually, and you have to be very cautious about using this Botox treatment. In your regular practice, how many of the patients are there to get Botox treatment, and what is the actual ratio?
Well, in our daily practice, we found so many persons come for the Botox because nowadays people are want to show their face in the media and like Facebook video or YouTube video and go for the adding or in their own advertise or any live programs and also in the media persons. So botulinum toxins treatments actually treatment is increasing day by day because of the huge demand of the peoples, and also due to in our appropriately in our country for that, because excessive sunlight can causes the acceleration of the aging process. Okay, so when the sunlight comes in our skin gives some protection against the sun, but with the increasing the sunlight and with increasing the age, our aging process accelerates. Our DNA is changing, our collagen fibers are diminished, our supporting cells like hyaluronic acid and other ground substances, also the elastin fiber which makes the elasticity of our skin, it reduces. Also some some activities of our osteoblastic and osteoblastic activity are altered. That's why with the age our osteoclastic, which breaks the bones actually, this activity increases. So which bone pulls the muscle, it becomes loosened. That's why our wrinkles comes very early, right at this moment. So we are getting so much persons and interested people to go for the Botox because our face facial muscles are mostly used muscle. Like every time we speak, we show some gesture, we sing, we recite anything, our facial muscle is always working. That's why we have so many people that have deep wrinkles in their forehead, also in the some faces. So ratio of our botulinum treatments are increasing day by day. So we are getting it almost every day. Some patients we are getting for the botulinum toxin, and people are very happy with the treatment actually, because it's a very nice treatment. If you're giving it with an expert hand, with adequate knowledge, and we know that how to avoid the complications, then it's the magical treatment actually, because it's a very fast treatment to get the outcome. Just few people get it from within a days like that, or highest there will be 2 to 3 weeks maximum. After that, if there is some not desired effect, then we give a touch up to the patients, so they are very happy with the treatment. And yeah, definitely there, if you give with a expert hand, with educated knowledge, and also if you know that what's the complication, how to avoid it, then it's very good treatment for everyone. Thank you. Right. And every time that when a patient come to us, then we judge at first that in which part of the body and which part of the face, actually in the up face. So patient need that botulinum toxin, we have to judge it, and we have to select the appropriate area and also appropriate concentration to apply in that area, because botulinum, the medication works like the relaxation of the muscles, because and our muscles have some activity with some called that acetylcholine, which activates the neuromuscular junctions. So we give the botox in that particular muscular area which is more activated and more actually functioning. So when we give this botulinum, then the acetylcholine cannot be bind with the neuromuscular junction, so muscle become relaxed. So apparently what happened, that were wrinkles of our dynamic wrinkles actually of our forehead or our face, it disappears. But remember one thing, that not every time we vanishes all the wrinkles, because you should have some natural looks, because if you do not have any natural looks, no wrinkles at all, then the face may be like a mask. Okay, no expression will be there in your face. So we consider to having some wrinkles in the face with the treatment. That's why we have to apply and we have to judge that which concentration should be needed in a which persons. And one thing that we have to take the appropriate history actually, that which kinds of work the person is doing. If he has works which is related with the excessive sunlight exposure, so our treatment pattern is different, our treatments concentration, treatments area is different. And if the person works in the home area, like he never goes to the under the sunlight, so their treatments concentration and treatments planning is a different way. So every person, every gender, every age has no single kinds of unit or single kinds of modulator that to use in the face or any area. So at first we have to judge that thing, that which persons need which kinds of concentration. And what
Thank you. May I ask a question? A
yeah,
question
please.
from an audience. He said, "Is there anything I can do if the results are not what I expected from Botox?"
Well, thank you very much, audience, for your excellent question. Actually, uh, some persons have the benefits within the 2 to 3 days. The maximum benefits will come, and you can realize that after 14 days. But if the um, desired effects doesn't come, then we give a touch-up treatment after 14 days at least, because you have to wait 14 days to see that what's the maximum result, because over treatment with the botox is not good, because if you give the over treatment in the botox, then there may be some permanent relaxation, long-term relaxation of the muscles, facial expression will be less, sometimes it can droop the eyelid, also some eyebrow as well. So we have to treat with very cautiously. That's why we give some kinds of treatment and we wait to see the effects for 14 days. And don't worry, if the treatment result doesn't come, we will give the touch-up treatment after 14 days.
Okay,
Thank you.
so this is all about the touch-up treatment, but is there any extra caution within this 14 days, 14 days after the getting the treatment? So, what would you say about this topic?
Well, the cautions we have to maintain that after the treatment immediately, we suggest all our patients that do not lie within the 4 hours because the toxin is given in the appropriate muscles area. So if I lie down, then muscle become the treatments for this purified protein become diffuse. So it can affect the surroundings muscles, which I don't know need to treat at all. So don't lie within the 4 hours. Don't push or don't massage the area because there may be a little bit lump because I have pushed the toxin in this area, so there will be a little bit swelling, but it will go naturally. But if I rub this thing, same thing, it will diffuse. We appreciate our patients that don't go for exercise or also any heavy lifting or any facial movements must any work, like don't go for any singing a song or any speech for few days because you have to relax those muscles. Do not push, do not rub the area, do not give any heat contact because heat contact can dilute the muscle and deactivated the effects of the botulinum toxins. Also, if there is any redness or any kinds of pain or any kinds of swelling which is not suiting you, then you can apply the cold water and cold ice, but don't go for a hot shower, don't clean your face with the hot water, okay, and do not rub, and please avoid the smoking and avoid if you drink alcohol, then please stop that one. So these are the cautions we have to tell our patients, and yeah, our patients are very nice, so they maintain these cautions. That's why they are getting very good result as well. Thank you.
Okay, so but maintenance of all these cautions is not so easy. The normal life routine will be hampered actually, and the patient cannot attend his or her office for the next few days, as you have told about the cautions. So, what do you think about that?
No, actually practically these questions is not very much difficult for the patient because he or she can attend their office, they can do everything, no problem. But do not overuse, like do not go for the gym, because if I do not go to the gym for 2 days, it's not a problem, it's my hobby to go to the gym, so I can avoid these things. No need to rub these things because without rubbing I can go to our office, no problem, because the swelling immediately after the treatment there may be a swelling, but it will go away within 2 to 4 hours, maximum 1 to 2 days. So it's not a problem for for our gentlemen or ladies who came to us for the treatment to not to attend the office. They can do anything in their day-to-day life, but do not apply any hot thing or any rubbing or any messaging in that area which are treated. So they can do because sunlight exposure is not a problem for botulinum toxin treatment, so they can go to their office normally, so it's normal, they can maintain
Okay,
this thing.
that's a good news. Actually, I wanted to clear it to my audience. Actually, this is we are about to end of our session, and I want to know at the last, and this is my last question. Actually, in this era, in this our modern era, we can see that the aging process is starting in a very early age, at a very early age. What do you think, or what are the reasons behind this?
Thank you very much for the nice question. Yeah, this is in the modern area that our timing of the aging process accelerates because the global warming is the most important cause behind this one. Because the sun rays, sun heat of the sun can cause the damage of the ultraviolet protection of our body, that is melanin, and also is changing our DNA. Also, it hampers our collagen fibers as well as our supporting agents like ground substance and hyaluronic acid, allowing the muscle attachment with this elastin fiber, and also our bones are become resolved. That's why our aging process is accelerated. And also the fume in the environment, also the smoking habit, and also alcoholism, everything is increasing our aging processes. So we can maintain our habits, so it's not a problem. We can use sun protection like sunscreen, and also we can use some protection like umbrella, and we can avoid the excessive sunlight exposure. Sunlight is important for our body to production of the vitamin D, of course, but do not go for the excessive sunlight. We can use the protections, so we can avoid the aging process delay. But aging process is a natural process, so it will go with the time, but we can hold the acceleration. We can't stop the at all the aging process, but we can hold the acceleration. So we can do that with sun protection, with sunscreen, without having a smoking habit or alcoholism. We can hold this
Yeah,
accelerated process.
with a healthy lifestyle actually, and the healthy
Yeah,
lifestyle
definitely.
will halt our aging process, and it will occur physiologically in a normal process, and uh, we will have to go for our Botox treatment, and there are many other modern treatment for skin and hair problems in the Lamano Aesthetics and Laser Center. You can go there, dear audience, and their contact number is on our scroll, so you can take it and you can call them. Lamano Aesthetics and Laser Center is with us. I want to thank them for being with us. And this is the end of our session. This is the end of our episode. And Assalamu alaikum and good evening, everyone. Thank you very much.
Thank you very much, dear audience, for being with us. Thank you very much, Dr. Urmi, for your nice speech. And also, Lamano Aesthetics, we are here with for you patients. And if you need any kinds of help, apart from Botox, of course, and any parts of aesthetic procedure, we are giving you every day. So contact with us. We will give you the appropriate treatment. At first, we have to judge you that which treatment you should take, and which treatment will be appropriate for you, and which duration. Okay. And I want to tell you one thing, that Botox should be treated is a regular way, because after the 6 months the muscles botulinum toxins activity become disappear. Okay. So within after 6 months, monthly, you can take the botulinum toxin treatment. It's not a permanent treatment, remember that thing. So you have to always come for the regular treatment. Okay. Regular follow-up is very much needed. Don't go for the touch-up, is a different thing. Just after the treatment, after the 14 days, we will give the just minimize treatment, that is called touch-up. But follow-up is a different thing. After 6 months, the botulinum toxins effect disappear, so you can come to us and we will give another treatment for that. Thank you very much, our dear audience. Thank you for being with us, and thank you. Goodbye, and keep smiling. Thanks.